Thank you for allowing me to come today and share our unique perspective. We are a 25-bed critical access hospital that also has a 120-bed skilled nursing facility attached. So we're a little bit different situation than some of the stories that you've heard here today. And actually our situation is a little different being in New York too than some of the things that I've heard here today. But I did want to let you know about the hardships that we're facing here. So being in a nursing home administrating position, the changing regulations have been difficult for us to keep up with. The regulations have been changing constantly, and with a limited number of staff and resources to be able to implement those changes, it is difficult to comply with them. The penalties for noncompliance in New York State equal a misdemeanor or a loss of your operating certificate, or for a nursing home administrator, that misdemeanor would mean loss of your ability, your career, basically, in the future. And so the other thing that happened here on March 25th, 2020, Governor Cuomo and the New York State Department of Health issued an executive order that prohibited nursing homes from denying patients admission or readmission to a nursing home based on the confirmed COVID positive diagnosis. We were very thankful and lucky here to be part of a health system. We're a part of Cuga Health System. We partner with Cuga Medical Center, and we knew from the beginning that that could have a devastating impact on our nursing home. And so we worked together in order to ensure that we actually would never admit a COVID-19 patient into our nursing home. And I think that this is something that actually could be regionalized in New York State and possibly other states as well. So we worked together to ensure that any COVID-19 patient that was positive that came to our facility was actually transferred to Cuga Medical Center. If they were going to be admitted to the nursing home, we kept them in a swing bed stay until we could confirm that they were not positive COVID patients, so that they would not be injected into our nursing home. And I'm happy to say that as of today, we have not had a positive COVID case in our nursing home. Another issue that we face that's been talked about already here is staffing. So even prior to COVID-19, we had a nationwide shortage of registered nurses as well as CNAs. Pay is part of the reason that we talk about that. But that we've had to reassign those critical resources that we have to other duties. So RNs have been reassigned to swab staff. CNAs have been reassigned to man tables and screen people as they come into our facility. This does leave our residents with less face-to-face time with the caregivers that provide the services for them, and could lead to quality issues in other nursing homes where staffing levels are not as adequate as ours are. Resident quality of life is another issue that has been faced here. And although we do understand the need for the measures that have been put in place, such as swabbing staff on a weekly basis, we would respectfully request that perhaps metrics be developed to allow visitation in some nursing homes, such as our county, where we have only had 14 cases of COVID to date, and do not have any active cases in our county today, because this puts the no socialization rules that have been put in place by executive order here are causing our residents to face anxiety and depression. I round in the nursing home regularly, and I had one of the residents grab my arm and say to me, "Can this last forever? Can I really not see my family again?" These people are just distraught. And so we need to work together to find a way to work with administration and the Department of Health to figure out how we can allow safe visits in our nursing homes. Reimbursement is the last issue that I wanted to talk about here. I am happy that we do have staff testing in our facility and that we are being able to detect people that have COVID in our hospital. But there is a cost and a price tag that comes along with that. So for us, it is $100 for the processing of each COVID test that we send to be processed. That does not include the PPE cost. That does not include the courier cost. That is costing our facility $28,500 a week. That is $114,000 a month, or if you did this for a full year, that would be $1.4 million. Nursing homes run on very thin margins, which is why we have such staffing needs, because we can't afford to pay somebody like our competitor, like Target does. So it's hard to retain those staff providing such an important service, but it's also hard. It's not easy work. And so we do need fair wages for those people. And in order to do that, we need to see increases in the rates that we receive. We have received, I do want to be fair, we have received some PPE testing, PPE and limited testing supplies from our state, but we have received no funding directly for the testing regulation that has been imposed upon us. So I do want to reiterate that we are lucky that we have not faced some of the challenges that others have talked about here today. And we do want to provide a safe, caring environment, and we do want to comply with the regulations that have been put upon us. But I did want you to understand some of the other challenges that we do face in our roles in caring for the vulnerable population directly. Thank you for your time.
Thank you for